represent the land of the Muwinina people, and I wanted to pay my respects to them and to the Palawa for their ongoing custodianship of this land, their care for country and community. And today's conversation is focused on data relating to children and young people, and I particularly wanted to acknowledge the ongoing and excellent leadership shown by Aboriginal leaders across not only Tasmania, Lutruwita Tasmania, but Australia in relation to how we can protect and support our children and young people. So we're here for a very exciting session today. We've got some fabulous presenters, Marketa, Catherine and Isabelle. We are going to be hearing about the Australian Child and Youth Wellbeing Atlas, and there'll be a presentation, there'll be a facilitated discussion, and hopefully some time at the end of today's presentation for questions. We would encourage everyone to raise your hand if you've got a question during the facilitated conversation, or alternatively put the questions in the chat. But we will try and leave time at the end so that people can address their questions in person. But all of our presenters have very kindly also agreed to provide responses in writing if we're not able to get to your questions today. So just some very quick housekeeping. If you wouldn't mind please keeping yourself on mute. The session is being recorded and the recording will be available at the end of today's session. Okay, so we might just kick off. I won't talk for too long about the Atlas because Catherine and Marketa are available to give you a much more in-depth conversation and discussion of how the tool works. But this is a recently developed national tool which is using over 900 datasets from across all Australian jurisdictions to map the needs of children aged 0 to 24 in communities across Australia. So we're hoping that today's session will provide a bit of an opportunity to see how the Atlas works and for you to consider how you might be able to use the tool in your policy and practice. So we're joined today by Catherine and Marketa from the University of Western Australia. So Marketa Reeves is the project manager of this particular project, who holds a Master of Arts from the University of Mannheim in Germany. She's been working since 2022 as a senior project manager at the School of Population and Global Health at the University of Western Australia. And prior to her current role, she worked for over a decade with the Commissioner for Children and Young People in Western Australia. She's joined by her colleague Catherine Rennison, who is the Senior Project Officer, who holds a Bachelor of Science in Psychology from the University of Western Australia and a Master of Public Health from the University of Sydney. She's working on the Australian Child and Youth Wellbeing Atlas since late last year, and prior to this role has held positions with a number of research and community organisations, including the Cancer Council and the Kids Institute. Joining us for a facilitated conversation following the presentation of the Atlas, we have Isabelle Crompton, the Interim Commissioner for Children and Young People. Isabelle holds Bachelor of Law and Sociology from the University of Tasmania. She's been working at the Office of the Commissioner since 2011, serving as Director since 2021, and was appointed as Interim Commissioner last year in October. Prior to her work at the Commission, she worked for over 20 years in legal practice, engaging in advocacy, policy and law reform relating to the rights and wellbeing of children. So thank you very much all for joining us. And I'm going to throw over to Marketa to give the presentation on the Atlas.
Thank you, Meg, and thank you for the lovely welcome. Welcome, everybody. As Meg has already mentioned, my name is Marketa. I'm the Project Manager of the Australian Child and Youth Wellbeing Atlas, and we feel very fortunate to have been invited to present and demonstrate this exciting tool to you. What we might do is I'll just spend no more than 10 minutes to explain what the Atlas is, a little bit about the background and some of the key drivers, both in terms of the vision and the mission behind the Atlas, as well as the passion of the team. And this definitely is as much a passion project as it is a mission project. And then I will demonstrate the Atlas. Take about 15 minutes to just show you some of the data specifically for Tasmania that you can then sort of go and look up yourself. If you feel confident and perhaps you've already heard of the Atlas, you're very welcome to open the platform yourself while I'm speaking. If you've got two screens open, when I go into the Atlas, feel free to start browsing. But at the same time, make sure you're not getting too distracted with the functionality. So I'll try to navigate those two things. And then we'll come together for the facilitated discussion, which will be very exciting. So I'm really looking forward to that. Oh, and now that we've tested the slideshow, let me see, here we go. Look, I'd also like to acknowledge the traditional owners of all the lands from which we're meeting here today, but for Catherine and I, this specifically is the Whadjuk Noongar people who've been the traditional owners of the southwest of Western Australia for over 45,000 years. I'd like to pay my respects to their elders past and present, and especially to all Noongar children and young people and the emerging leaders among them. Look, the National Atlas is a project that is really carried and driven and governed by a national partnership. It's not possible to have a platform that includes data and information from all jurisdictions without having a strong partnership. I've just got a couple of organisations here on the slide, but really there is strong academic partners. UWA is the leading university here, but we've got strong partners across the country in the academic sector. A lot of government partners, both across policy as well as planning, not-for-profit organisations, and we're currently funded by philanthropic organisations, most importantly the Minderoo Foundation that I need to acknowledge here, and the Ian Potter Foundation. And I'd also mention that we have strong partnerships with local governments across Australia, and we have a young people advisory group and work very closely with them, as not only do we see children and young people as one of our key user groups, but also this is information that belongs to them. So all the information in the Atlas is for and about children and young people, and so therefore their involvement is critical. What we bring together with the Atlas is data on 0 to 24-year-olds. So that's really important to understand. We're not a whole of population platform. We focus specifically on children and young people 0 to 24. Where we can, we disaggregate data into smaller age brackets. So if you're looking for data for 0 to 4-year-olds, 5 to 9-year-olds, and sometimes, if possible, we bring it down to individual year levels as well. So that's the key focus. The dataset is free. And we really strongly believe that to work on democratising data and information and providing equitable access to everybody, the platform needs to be free. It cannot be that we have a fee-only access. So it's a free data set. It is holistic in the way that we understand well-being of children and young people. We have used Erases the Nest, which I'm sure a lot of people here on the call will be familiar with. So we've used Erases the Nest and the 6 key wellbeing domains identified by the Nest to help structure the information and data in there. Meg has already mentioned there's over 900, and now it's actually well over 1,000 data sets. And to help with some of the risk of overwhelm, we have structured it by the Nest, but that allows us to be holistic in our approach, and the platform promotes equitable accessibility. 4 key things that we're trying to achieve here. Firstly, we want to provide access to data. We understand that getting data is often not only resource intensive, but also time intensive. Relies very much on the skill of people that you have in your organisation, on the time you have available, and quite simply the money that you have available to request all the data that you need to understand what the picture is of children and young people in your community. So it is about access and providing access to everybody who works for, on and behalf of children and young people and is tasked with making decisions that impact them. We're also very keenly aware that visualising data and information is important to be done in ways that provide access to as many people as possible. Not everybody holds a statistics degree, not everybody loves a spreadsheet. So providing data in a more visual way and bringing it down into it's called geospatial way, just to bring it on a map, really opens it up and unlocks a lot of the information that otherwise, for a lot of people wouldn't be able to be seen if they just look at numbers in cells. The third key driver is analysis. So for people who want to then go deeper, we provide the opportunity to download full data sets so that you can take it away, do your own analysis, be that in a particular software that you use or for further research. And the 4th key thing that the Atlas does is it allows to monitor. So by providing data not just for a single year, but going back 15 to 20 years and then having data going forward, it allows you to look at a point in time and say, you know, you're aware that a program was implemented at a particular time or an initiative or funding was awarded, and then go forward and 3 years later see what change you can see across the key indicators that would be relevant to that program. So those 4 things are key there. Look, and really what we have found, and this is from working with data, and not just administrative data sets, but data, you know, about children and young people, is that data is often held by a few. Not everybody has visibility of it, and because of that, decisions that are made aren't always evidence-based. They're not based and made based on information that we have, and so because of that, we are running a real risk that children these days will be worse off than the generation before them if we don't unlock this information that we have to help us make better decisions, put better programs and interventions in place. Just a couple of things I will pick out here. So it's important to understand that when you look at the Atlas, what we want to see is the data for communities. So it's very place-based, it's very community-focused, because we understand that children grow up in a community, and the community that they grow up in has such a strong impact on their wellbeing outcomes across the board, across all those key wellbeing domains. The community really shapes children, and so looking at data for Australian children overall, or perhaps just for one state, does not provide the granularity that we need to understand what it is exactly that children and young people in a particular community need. A couple of other things here on the slide is that, you know, data is often held in a multitude of disparate locations, and to sort of be able to get that comprehensive picture, all the data from the different agencies and departments has to be gathered. So the Atlas kind of does that work for you and provides it in one sort of package and one platform that is free to access. A couple of words around privacy, and we get asked this a lot because you very quickly get into small numbers. If you're looking at small community data and you're looking at a subpopulation, in this case only children or only young people, you do run into small numbers and suppression becomes really important. So we do not show any personal data. We suppress according to really standard guidelines. So we suppress small numbers, low counts it's called. So if we know that in a population there are, say, 3 or 4 children who are as part of that count, that has to be suppressed. We also suppress small population just to make sure that there is absolutely no risk of re-identification. And there is something called the 5 Says. The data savvy people amongst you will know what that is. I will not go into this here. I don't think we have the time for that. But if there's any questions around safety and what we do to the data to make it safe to be published publicly, please come back to us or just shoot me an email. I'll be very happy to have that conversation. Now, just for those of you who aren't too familiar with the NEST framework, I've put the domains on here. You can read them for yourself, but I just want to focus on a potential 7th domain. We are all aware of how important environmental sustainability and climate change is, and not only that, we also know from speaking with children and young people that climate change is a key concern, not just a key concern of interest, but also it can be a real stressor for young people, a real lever for anxiety. So we understand that information around environmental sustainability and climate change is important. And while the RACI are looking at ways to include those indicators into the NEST framework, we are already preparing indicators to be included. We will add a 7th domain, even though it will not officially be a NEST domain, but we just feel it is so important. So watch this space. Over the next 3 to 6 months, we will be adding a whole raft of indicators around air pollution, noise pollution, flood risk, heat risk, and a lot of other related indicators. This might be a bit small for some of you to see, but a couple of words around what data we have. So I've mentioned that we have those 6 key wellbeing domains, but the situation at the moment is not that data is evenly spread across all those 6. So when you do go into the platform, you need to be aware that not all domains will hold the same amount of data. By far, the most data sits currently under healthy, and that's to do with data that is not only accessible, but also that is available. We also have a lot of data in the area of learning and around valued, loved and safe. And to be honest, material basics is pretty well covered too. Where we don't have much data and where as a nation we're just not good at all in gathering this information is around identity and culture and around participation. There are no nationally standardized data collections at the moment that would give us a strong picture of how children feel in community. What is their sense of belonging in their community? What is their sense of belonging at school? How do they get along with their peers and how do they get along with their family? So all those really important indicators around belonging and around safety. So how safe do children feel? And how confident are they in reaching out, and how do they assess their opportunities to have a voice and to participate? All those things we have very scarce information on, and it's commendable that quite a few jurisdictions are running what's called wellbeing surveys with young people, but the information is often not published. And if it is published, it's only summary indicators and they're very little to go by. So what the Atlas does as well is it shows the gaps. It shows the gaps in our data collection efforts, and not to say that those things aren't important. We just really need to make a strong case for advocacy around those indicators of wellbeing as well. So let me jump in. Our URL is australianchildatlas.com. Very easy to remember. You can just put into your search bar Australian Child Atlas. And when you click on that, what brings you, the link brings you first to like a wraparound website from where you can access the maps. Before we jump into that, I'll point out a couple of things around the top banner, and that will help you get the most out of the platform. So firstly, I'd like to mention the indicators. So those 6 domains of wellbeing, we've got them all listed here. You can click on any of those and it will show you which indicators under that theme or domain are included. So for example, I can click on, let's jump into the ADC. These are the indicators that we've included. It also gives you a little bit of policy context and references for further reading. So if you're not sure, you might be going to the platform knowing exactly, okay, I want information around this. I know this data collection exists. I know this indicator is there. That's fine. There's a search box. You can do that. But if you're not too sure, but you want to look at indicators around learning or education, under this tab, you can find a list of the information that's available. In addition to that, we've got a full comprehensive document that shows you the metadata. So that holds all the information about where the data has been sourced from and how you can go to the source if you wanted to do that yourself. And it explains some of the technical information such as statistical methods, information around visualization and a licensing agreement. And then under resources, we find user guides. We have in our recent evaluation with existing users heard that only about 20% of people have accessed the user guides. And really without that information, it could be a little bit challenging to get the most out of the platform. So I would urge everybody here to either watch the video, it's 3.5 minutes short, or there's a downloadable user guide. It's kind of like a slide deck PDF format, which you could have open while you're browsing or navigating the platform. So those resources are there. But let's jump into the maps. So when you first come into the platform, the first thing that opens up is number of births. This is just the default setting. From here, you can click on the other themes and see there's a recurring theme here. So here are your 6 nest domains again. You can click on them. Let's just click again on learning. Sorry, I've double clicked, and you see the same indicators that I was just showing you on the website. They come up here and you click on them, and that's how you kind of find your way. It's very much like a tree structure where you sort of go through the indicators. If you don't want to do that, but you know that you're looking for ADC data, you're looking for school attendance, you're looking for homelessness information, you can type that information into the search box and see what comes up. So that's one way of navigating. Another way to navigate is to put in an area of interest. So if I know I've got an area, but I'm not too sure yet if it's a small community or a bigger community, you can type in a suburb name, a region name, and then just be sure that, let's for example say I put in an area in WA, and then if I knew how to spell it, that would help. You could type in Katanning. Sorry. And then always make sure that you click on the one that has the state attached to it. This is so that the map goes to the actual suburb or the community, and then you can click on that community and the information will start to build. So you can either do an area search or search by topic. So here we are in Katanning, that's in the southwest of Western Australia. You see we're still in number of births. I have highlighted that area, and so with one sort of click I can see the number of births in 2023. I can see where that sits on the national distribution and the time series. But let's move out, zoom out and jump to the state of interest today, which is Tasmania. So you can, as you can see, I'm navigating this very much like I would with Google Maps. You can zoom in, you can zoom out, and highlight areas here. Sorry, this is not. If this happens, very good example, refresh your map and then zoom in again. So for number of births, let's just go into, we'll start in places this kind of with a green shading. Let's start with Rockaby. And you can see you can just with one mouse click jump from one area to another and the results would build. So I can see Rockaby 2023, 185 births. That is interesting because in 2022 it was only 122. So that's a really significant increase. Straight away the question would be services, programs, child and parental maternal health services. Are they there? Are the schools there? Is the childcare there that, you know, families will need? Same in neighbouring areas. I've got Kingston Huntingfield. Again, one click, I can see, oh, different picture here. They've had a receding trend from 173 in 2021 down to 151. I jump into Gorell, same thing, also a downward trend. So this way I can make my way around particular regions and look at the trends that there are. If we zoom out a little bit out, I did have a bit of a look yesterday and what jumped out of me was Sheffield, also an increase, or here. So you see I'm simply going by the colours. Now the colour chart works from a low score to a high score, and that's how the colours work on the map as well. So the map is in a blue or green if the score is low, and it goes into the orange or red if the score is high. Now, it depends on what indicator you're looking at. So for example, if I'm looking at the percentage of children born at low birth weight, I want the map to be predominantly blue, and areas that have a high rate will be in green, orange or red. But if I'm looking at, say, immunisation rates, I want those to be high. I want a large, a very high proportion of the population to be vaccinated. So the map would be predominantly orange and red, and the areas at risk would be the ones showing in green or yellow. So here with number of often people ask, oh, so can I revert the scale, so that I can always see the positive outcome in the blue and the negative outcome in the red? But that's difficult to do with indicators because even just number of births, it's hard to determine, is a high number of births what the community wants, or is a low number of births what the community wants? So there's already an indicator where it's very difficult to determine whether a high or a low score is the positive outcome. So as you're navigating through here, you'll see that anything that's more green has a higher number of births. So, those are the areas where lots of babies are being born. Now, if we go into Burnie, which jumped out at me yesterday as I was having a bit of a look. So they're on a bit of a roller coaster with the number of births, 73 in 21, then down to 40 and up again to 64. So related indicators, once I'm looking at health at birth, are things such as infant mortality, low birth weight, preterm births. So if you're looking to get a good picture of the situation of, you know, health at birth of children born, let's say in Burnie, I would then go to, let's look at the percentage of children born low birth weight. And I can see that there's certain areas that really stand out. So Burnie has 5.8, that's kind of just off the national average, but it has had years with really high percentage up into the 7%. There are areas like the northeast that are even higher, or the west coast that are higher still. So this is well above the national average of what we want to see in terms of percentage of children born at low birth weight. And if I make my way through, I can see very similar trends for children being born prematurely. So that for us means being born before 37 weeks. Again, you see how the colours are really starting to show here. So the grading here for Burnie, 84% of babies born preterm, that is well above the national average. We've got the northeast, again, we already saw high rates there for low birth weight, so the same with preterm. And I had a look yesterday, the same applies when you look at smoking in pregnancy. The one that stands out really here is Brighton. And I'll say straight away, as I was going through the data, Brighton really stood out as one of the communities that had really high scores across a lot of the high risk indicators in health at birth, and later on as well. You can see that sitting up with only a very small number of communities that get over the 10% of children being born preterm. So that is a high concern, particularly if I then consider the timeline and see that this has been a situation for quite a long time. So this is not a new experience for Brighton, but they've had these indicators for some time. So this is just sort of to show you what you can see when you look at preterm and early childhood indicators first. I've made a note, so Brighton definitely stood out there. The West Coast stood out, Burnie, and also the Central Highlands as being communities with well above national average, and even for Tasmania having the highest scores when it comes to those health at birth indicators. I have then looked at immunisation, a couple of areas that stood out there, and it's always people kind of with immunisation, there's a little bit of expectation that we have, but let's just look at fully immunised at 1 year. And remember how I said we want to see the map being predominantly orange or red here because we want high vaccination rates. I can see that there are areas such as Meander Valley who are below the 90% mark. Same for Southeast Coast, 88%. So that's very low and well below the national average. So for immunisation, again, a couple of areas that quite clearly stand out here. Let's change into a different domain and go into learning. The Australian Early Development Census, I'm sure everybody here is familiar with those. And unfortunately, we don't have the 2024 data yet, but this is forthcoming. So I just want to show you what the map looks like for Tasmanian communities for one of the key indicators of developmentally vulnerable on 2 or more. We want this percentage to be very, very low. So ideally in the blue. If I see a darker colour, that indicates a high number of children that are developmentally vulnerable on 2 or more. Whoops, I'm looking at the wrong year. So see how I'm using the filters here at the top? These filters allow me to go through different collection years. See highlighted are all the years where the AEDC was collected, 2021 the most recent. And here is where we change the geographies. Probably don't have time for me to go into them too much, but the smallest one would be SA2. See how it goes into really small community view, and then one bigger is SA3. So let's jump into SA2 here for the ADC. And you can see just by zooming into the map where those areas are with really high percentage. So in Bridgewater Gagebrook, 34% of children were deemed to be vulnerable on 2 or more domains of the Australian Early Development Census. A similar picture, is it East Devonport? In East Devonport. Also, that's a really high result for that indicator, and the same on the West Coast. If you wanted to interrogate that further and to see which domains in particular are contributing to these results, you can then look at the individual ADC domains. Another indicator that's important for learning is childcare. I mentioned this. If we have a high birth rate or a high number of births and we want to look at services, it is important to see if childcare availability is high or low. So we have childcare availability. We can look at the percentage of the population living in areas of low levels of childcare, or to look at how many places per child there are. So let's just look at percentage of the population living in areas of low levels of childcare. Now, this is a bit of a brain exercise. You want that percentage to be low, because you don't want people to be living in an area where there is low supply. You want there to be a high supply. So the fact that large parts of Tasmania are orange and red indicates that there is not enough childcare centres, not enough services available for children to attend. There is a couple areas that stand out. The green and blue ones here are the positive results, but I can see that outside of any urban areas, there is very low supply of childcare. With the map, you can also overlay with childcare centres. That's an additional functionality. Before I can see the time here, so I only want to spend another 2 or so minutes to show you that you can then move forward with your interrogation. And if you go into, say, material basics, we could look at the percentage of children living in a household that's earning less than $1,000 per week, which is defined as a low income household. And here we could then change to look at older children. So for example, 10 to 14. And you can see the percentage here. So what this map is showing now is showing areas where there is children 15 to 19, so young people, 15 to 19 who are living in a household that is earning less than $1,000 per week. And again, you can see clearly a couple of areas standing out. So Ravenswood would be standing out here. St Helens, I go into Burnie, Acton would be standing out with 31%, however, a downward trend. And then looking at Hobart, you can see those areas with high percentages. So this is a different indicator within material basics. You can also look at CFA indices and how the particular community does on the CFA indicators. And the last one, because that was in my previous discussion with Meg that was brought up, a lot of information around homelessness and specialist homelessness services. So the percentage or rate of children and young people who are recipients of specialist homelessness services. This is information gathered by the AIHW, so we have all that information included here as well. So as you can see, the whole breadth of the lifespan from 0 to 24, as well as a really wide range of indicators. But I will leave it here just as a first snapshot of how the platform allows you to look at a lot of information, and I'll give back to Meg so she can lead us into a bit of a broader conversation.
Thank you so much for that, Marketa, and that was really, really useful. And I think really nicely is a bit of a segue into how, what we're hoping the focus of the session will be today, which is trying to translate that data, and you've done a little bit already, into how this could work to support children and young people in Tasmania and the community organisations that are working with them. So, Isabelle, I'd like to turn to you first.
Sure.
In your role as Interim Commissioner, you really, a huge part of your job is listening to the voices of children and young people across the state. And I wonder if you could share with us what you're hearing from them about their needs, the things that they're worried about, and, if anything has come up for you, I guess, in terms of what you're hearing on the ground from children and young people in relation to that data that Marketa's just shared with us.
Yeah, look, thanks, Meg. Great. There's so much food for thought and such a wonderful presentation, Marketa, even just a snapshot of what the capability of this atlas actually is. Just before I start, I should acknowledge the traditional owners of the land that I'm joining you on from today. I'm on Flinders Island, so I acknowledge the Palawa people of the Truway Nation today, and I pay my deep respect to their continuing connection to the land, waters, and enduring culture of this place, and obviously pay my respects to any Aboriginal people joining us today, and to the traditional owners of the places where you're joining us from. So I've been really privileged to be on the steering committee for the Atlas project, and the former Commissioner, Commissioner McLean, was also involved in the project from very early on. I think Marketa would recall some of those very early conversations. And it's pretty clear the data capability is just growing significantly. You've just received a brief snapshot. I think there's data that's been added since the last time I had a play, which is really exciting. Just going to the question though, Meg, understanding what makes for a really good life for children here growing up in Tasmania, it's just so important to understand from their own perspective what's essential. And that of course can help inform and guide policies and programs and services. And I think it's really important to acknowledge that lived experience of what it's actually like to be a child or a young person growing up in Tasmania today. And of course, they're not the only experts in children's wellbeing. I mean, there's a range of expertise that's relevant. Scheduling of immunisation all the way through to what works in terms of literacy development. But they do have a right to have a say on these issues and related matters, and for their views to be taken seriously and considered in decision making. And so, and I think through listening, we make vastly improved decisions and understand what's actually going on from the perspective of children. So I think it's a very important part of my role to amplify what children are saying and to listen to them and take that and advocate and support them to also self-advocate. A really good example of what we've been hearing from children and young people in Tasmania relatively recently, as late as just late last year, was through a postcard activity that we ran to help inform something that could have been quite dry, which was the submission on draft legislation to establish the new Commission for Children and Young People here in Tasmania. But the postcard had extraordinarily broad appeal, and we had fantastic responses from almost 700 children and young people across the age spectrum. And I think the wealth of information we received really extended well beyond the scope of preparing a submission on a bill that would ensure that the functions of the new Commission would be covering the sorts of things that children need that new Commission to be standing up and advocating on. But it also really just helps inform other initiatives, including the further development of the Atlas itself. And to assist us to map what we're seeing in the data against what's actually being experienced by children across our community. So in response to that engagement activity, which if people are interested, you can search for our website and just look for Letting Them Have a Say, which is the report of the engagement activity. What we heard from very young respondents was a real focus on immediate relationships and very basic, daily needs. But we also heard from young people, and to be really honest, too many children across the age spectrum, about challenges associated with financial insecurity and housing, mental health support, safety came up significantly. Housing, food, education, just consistent across all age groups. And I'm really conscious of time, so I can go into more detail about that, or I can really strongly encourage people to, if they're interested, to have a look at that report. But I think, going to the point around data collection and that importance of being able to consider what we're hearing from children and young people about what really matters to them and what they are seeing as areas that need more attention, and then looking through this, extraordinary platform like the Atlas to be able to see, well, what is actually going on in terms of the data, the numbers data, to help create a more rich and fuller picture to understand that experience within context. So I'll just stop there, Meg, because I'm conscious of time. I can keep going if you had any follow-ups, though.
Well, I think it might be interesting to turn, I guess, to what Marketa and also Catherine, who I'll invite into the conversation, what kinds of trends might be emerging for the project team as they analyse the data. I mean, one thing we were interested in is, you've touched on locations, but whether the tool demonstrates significant differences in the experiences of childhood, for example, in, rural, regional Tasmania as opposed to urban settings. Well, urban in quotation marks, I guess, in the Tasmanian context.
Thank you, Meg. A couple of things. So yesterday I did take a bit of time to sort of look at the data for Tasmania in more detail, more granularity. And so what I'm just sharing here, so we're looking at the percentage of 0 to 4-year-olds, so early childhood, little kids living in households that are experiencing economic disadvantage. And you can see that when we broaden it out to SA3, so LGA level, it's a very clear picture that emerges. So you see the green areas, the areas with the least economic disadvantage are around Hobart and around the Bay, but then straight to the top is Brighton. Brighton really stood out as a community as with high risk and high scores across pretty much all the key indicators. It would be what we probably would call a community with entrenched disadvantage. We can look at high smoking rates, high rate of babies being born preterm, high percentage of children are being developmentally vulnerable according to the AEDC, looking through NAPLAN, school attendance, all the way up to youth unemployment and economic disadvantage for young people. So we can see that there's Brighton and Hobart Northwest were those areas, but also on the southeast coast, and then up here with Burnie, Ulverstone. Here, when you use the map and then you actually flick to a smaller, more granular view, and this is, I've just picked this one indicator, you can see that the map immediately changes, and it's not those large communities as a whole, there are pockets within it. So, when we were speaking earlier, I was sort of drew the comparison that when we look at, say, for example, WA, we have areas in the northwest, the Kimberley, the Pilbara, who really stand out, and the communities there are facing significantly more difficult circumstances across a whole range of wellbeing indicators than what we would find in the less or least advantaged areas in, say, the Perth metropolitan area. In Tassie, I have found it's a mixed picture. So it's often neighbouring communities, small communities, door to door, and there is some really significant differences and contrasts. So it's not the bigger areas, it's small areas within a bigger areas. And then some areas I have observed seem to have more resilience, where we see high risk early on for children in their 0 to 4 years, but then this seems to even out once children are sort of primary, secondary school age. So some of the work that we're doing here as the Atlas team, we're looking at ways to start developing indices, to look at indexes not just of well-being and what are some of the key well-being factors, but also looking at community strength and how well prepared are communities to tackle the challenges and just work with the with the circumstances that they are facing. So how well prepared, how strong are they, how resilient are they, and what are some of those things? So the Atlas shows us with the data that there are some communities who are better equipped to take on the challenge, but what exactly is it that determines that? And look, we feel that by having this information, so just by making this information visible for communities, and not just for those who make the decisions for them, so by having access to the information, that already surely is empowering. It must be empowering to see that information for yourself that otherwise, only certain agencies have access to. But I will just, in closing, my response mentioned that for Tasmania in particular, we have no way reached all the information that we want. So we are approaching all states and territories for data at SA2. So let's say hospital admission data, emergency department presentations data, child protection data, youth justice data. We want these indicators to be available at community level. For Tasmania, we are far from that, so we're only just starting those conversations. In other states, we have been more successful, also because of the relationships going back for longer. So if anybody here is more interested to see what that looks like when you've got hospital admissions data, for really small communities, for WA, we have those things, or child protection at small community level. So if you're interested what sort of a picture you get, you can do a bit of a browse through the WA or Queensland data.
Flowing on from that, I guess, I would imagine that many people are attending this webinar today and thinking about how they might be able to use this tool and the data provided within it to advocate for their organisations, but also for children and young people in our community. So I might perhaps just ask you all to reflect on what your kind of takeaways are as you've sort of discussed these issues today. Maybe Isabelle first.
Sure. Oh, look, I mean, the presentation of the data really speaks for itself. I think it's, rigorous and available at no cost. It's, relatively accessible even for someone who's not a data boffin like me. And it's visual as well as, it's presented in ways that different people can use it for their own purposes. And I think, and as it continues to build, I just think such an extraordinarily rich picture of information. I think, we've long advocated through our office for data collected for, around children's wellbeing to be publicly available and simple and concise and relevant both at a population level, but also in that place-based space as well. And I think it was really interesting, Marketa, your observation about the sort of differences between abutting places as well. I think is really extraordinary and tells a story that I think requires far more consideration and thought to sort of really unpack and understand what that actually means. But I think from my perspective, as we move to, really, I guess, adjust our approach to monitoring children's wellbeing through a rights-based lens, this resource is already and will continue to build as a really extraordinary resource, I think, for us. And it's just been really good to be along for the journey. I think Tasmanians online with us today, or people who are familiar with the Child and Youth Wellbeing Strategy, would come to the framework with a fair degree of familiarity, I think. Our Child and Youth Wellbeing Framework is based on the ERASI domains as well and has been slightly adjusted to incorporate some of what you were talking about in terms of the environment, Marketa, but it certainly speaks our language. And of course, as we shift to a rights-based approach, which includes a wellbeing framework, which includes wellbeing as part of that rights-based framework, I think, it's just going to be an extraordinary resource for us.
I might follow on that then, Isabelle, and maybe give some really specific examples of stakeholders that have used the Atlas in those few examples that you've given there. So you really mentioned that it is free, and our mission of the Atlas is to make this data equitable and accessible to everyone. And a really strong example that we've recently received is an initiative from Mission Australia, who we are connected with through the Thriving Queensland Kids Partnership, if you've heard of them. they've gotten back to us and through their connection with the Atlas did a review of their paid data solutions. So we know that a lot of organisations are paying, big money to access agencies that will collect publicly available data and put it into a custom-built platform or, report for these organisations. And because that data is publicly available, they found through the review that I think over 90% of the data they were paying for was on the Atlas already. And the community profile is, of course, just for their one community. So the Atlas, you can jump around as Marketa was doing and look at neighbouring communities in WA even to do comparisons if you're looking at rural areas and things like that. And so through their review, they realised that the money that they're putting into this community profile can absolutely be shifted and put into community-led programs and initiatives. And just by accessing the Atlas, they've freed up that little bit of money for the organisation, which is really crucial. And the organisation actually also gave a really nice example that they've looked at their data and found a really high number of teenage births in the specific area of Queensland, so it was Cairns. And they then looked at the services available for those mothers and found that they actually were very well connected in Cairns, but it was the fathers that had no supporting services. And through that, they've now started looking into an evidence-based initiative for those young fathers to support them through having those young teenage births. So that was really nice to see a really tangible example of how the Atlas identified that priority for them. Secondly, I might just touch on the fact that we have organised the data by those ERACI domains, as you mentioned, Isabelle, and we've heard from quite a few organisations that just by structuring the data into those 6 wellbeing domains really helps conceptualise the data for them, and a lot of organisations are using the NEST ERACI framework in their own reporting. And even further, we've heard from a lot of LGAs locally in WA who are in the process of writing the early years strategies and doing strategic reporting and planning. And so having that data freely accessible and structured in ways that they are very familiar with has really supported their work in writing those reports. And I might just end with a really quick plug for our Young People Advisory Group, which Marketa mentioned at the beginning of our presentation. We've had a recent meeting with them. We do bi-monthly meetings. And at that meeting, we did a bit of a brainstorm about how young people can be using the Atlas. And a lot of them strongly told us that they, as young people, are very aware of the issues that are in their areas, particularly around mental health outcomes. And they aren't feeling heard on those issues. And just by having the Atlas to show that evidence-based data, and because it's visually accessible and the colours really speak to young people, they're not looking at the spreadsheet, they were able to really dig into that and take screenshots and things like that and use that in their advocacy efforts, so letters to politicians and reports and things like that. So they found the Atlas really accessible in that way.
That's fantastic and so amazing to hear. I'm very excited to see what else is coming up for how community organisations and particularly children and young people are able to use the tool. So thanks again. We've had I think 2 questions really come through in the chat, and I might just give people the opportunity as well to either raise your hand now or put a question in the chat if you've got anything you'd like to ask Isabelle, Marketa or Catherine. But Lucy asks firstly that it seems incredibly useful and that it would have taken a huge amount of work to pull together. So whether or not that's the case, but also whether you're aware of any similar work being done for other demographics. Obviously, this is a tool focusing on children and young people specifically. Anything else that comes to mind in terms of other areas?
That's an interesting question in the sense that most jurisdictions have some form of a population wellbeing dashboard. Sometimes these dashboards are publicly available, sometimes they're not, but there are whole of population dashboards for most jurisdictions in Australia. However, ours is the only publicly available children and young people map atlas, and it covers all states and territories. So for us, certainly we're unique in that sense. And what we're finding with the whole of population approach is that it's very difficult and often impossible to break the data down into those age groups that are of particular relevance for the demographic of children and young people. And also the indicators may not always apply. So a lot of the indicators that are important, Catherine just mentioned, mental health, housing, environment, they're often then not covered or not covered to, you know, a sufficient degree.
Yes, and what about the first question, whether or not it was a difficult exercise?
Absolutely not difficult. It takes a long time, and the work is ongoing. We've already mentioned data is continuously being added. I would like to urge everybody in the call, if you're interested, please sign up to our newsletter. It's quarterly, and we share what new data sets have been added or which data has been updated. So that process is ongoing. The data collection process is a benefit for the prototype, and now we kind of roll into regular updates. We update those collections that are that frequent annually, others are less frequent. So there's an annual update schedule, but new data is being added constantly. So it's always worth, just having a look and see what else has been added.
If no one else on the call has a question, I would like to hear a little bit more about the advisory group and the kind of interplay between the advisory group and the Atlas, and what might be next or ongoing for the involvement of that group.
Yeah, can I just jump into Jenny's question? I just saw Jenny mention that apparently DSS data will be added to the digital atlas. Yes, Jenny, and they're already in the process of doing that. So we have added income support payments, so DSS payments to parts of our platform. Sorry, I just need to jump. This is not the right one. I was going to show something else, but so if you type in income support payments, this is all DSS data that we have available. So we've got care allowance, family tax benefit, living allowance, up to 2022. Which is pretty much taken straight from the digital atlas, but brought down to children and young people. Sorry, there's a lot of data this needs to churn through. And then we can go into, it won't let me do it. This is, I'll do it again. Income support, let's go say family tax benefits. There we go. Let's see how, so we have that for all states down to SA2 level. It's 2023 available. Yes, that's super recent. And you've got your time series, the national distribution. So a lot of that is on there already.
Great. Maybe just very quickly, a very quick chat about the advisory group before we leave. Yes. I know we've only got 1 minute left, but.
Catherine, did you want to say a couple more words about the advisory group?
The Young People Advisory Group, is that? Oh, yeah, sure, absolutely. So we're in our second membership round now then. So from the very beginning of the Atlas, we've had young people involved in our first iteration of membership, and their primary role was to advise on the design of the Atlas, the website, so all of those user functionality key points. And now that the project is now maturing, we're now looking at how young people can use the Atlas and primarily how we can promote the Atlas to more young people. So they've jumped into a bit of an independent project stage at this point. So they will be looking into ways that they can promote the Atlas, whether that's through schools, through social media, through their various advocacy clubs. They're really well connected, these young people, and just really passionate about advocating for young people and their peers. So yeah, the membership runs to 2026, I believe. So they've got a whole year ahead of them. And it is a group of, I think, 12 young people from the ages of 14 to 22. So quite a broad range across Australia as well, not just WA based.
That's fantastic to hear. I'm not sure if you've got time to just answer that final question before we go, relating to what it means when data is coming up as suppressed.
Yes. So when data is suppressed, it means that there is a low count. Typically, that is a count of less than 5. Sometimes it can be less than 10, but typically it's less than 5. And the reason why it then has to be suppressed is because there's otherwise a risk of re-identification of, the people involved in that count or who the count refers to. And what it also means is that we don't just suppress that one count, we also cannot use it for any rate calculations. So then the map will show for that region, it will show like a stripy pattern where it's too small. So we know that there are counts there, but they're too small to be shown.
And we've just got a question specifically that NAPLAN is suppressed in Lena Valley. Did you want to just have a look?
Yeah, so that could be, is there an actual school in Lena Valley? So for NAPLAN, the data is based on school location, not where the students reside. So if in certain areas there is actually no secondary school or no primary school, then the NAPLAN results wouldn't be shown. Or if it's suppressed, the participating students would be too small. But we can have a look at that. Jessica, we'll get back to you. We'll take a closer look at Lena Valley.
Well, I'm conscious of time, and we've got a lot of people on the call who I'm sure have to dash off to the many other things that they're doing. But I just really wanted to thank you all once again for this amazing presentation and conversation today. And thanks to everyone who's joined us on the webinar today as well. I really encourage you to get online if you haven't already and take a look at the tool. And I'm sure that Marketa and Catherine will be very happy to answer questions that you may have about the tool. And thank you so much for the very informative and engaging presentation. We really appreciate it.
Thank you very much, Meg. Thank you for having us.
Thank you, Meg. Thank you so much for showcasing this. It's really appreciated.